The following show is for educational purposes only. It is not intended to diagnose nor treat any medical condition. Any information or recommendations provided should always be discussed with your healthcare professional. Welcome to the Patient Talks. It's Wellness Week, and on this week's episode, we're going to discuss why you shouldn't be embarrassed, why you shouldn't edit yourself, and why we're not friends. In most medical training programs, during the very first week of our training, we are presented with the gross anatomy lab, sometimes also known as the cadaver lab. In there, people who have donated their bodies to medicine in hopes that we can learn the practice of medicine are presented to us. And over the course of 1 or 2 semesters, we cover every square inch of that body from head to toe, inside, outside, front to back. There is no part of that body that we don't have our hands on. At the same time, we're also taking classes in physiology, biochemistry, neuroanatomy, all the things that come together to make up not only how the human body is put together, but how it works. We also have classes in psychology, abnormal psychology, embryology. After we've gotten through with the book part of it, then we move on to rotations in psychiatry, general surgery, where again, we have our hands in the human body. After all of this training, then we're ready to practice medicine. Now, the reason I told you all of that is because I want you to understand there's nothing you can show me that's embarrassing. There's nothing you can say to me that's embarrassing. I have seen the insides and outsides of a human, both living and dead. I have heard a little bit of everything during my psychiatry classes and abnormal psych. There's nothing you can say to me that should be embarrassing. There should never be any embarrassment when you go to see your clinician. We've seen all of it. And if we've been in practice for a few years, we've heard all of it too. There's nothing to be embarrassed about. Our job is not to judge you. Our job is to take care of you. So there's nothing going on that you should be embarrassed about. And you should absolutely never edit yourself. Again, we're not your judge. We're not going to shake our finger at you. But sometimes when you edit yourself, you can be giving us an incomplete clinical picture. And that can make the diagnosis difficult or flat out wrong. And that brings up why we're not friends. I touched on this a little bit last week when I was talking about becoming a patient. Here's the thing, if we are friends outside of the clinical setting, your likelihood of editing yourself goes way up. There's things you won't feel comfortable telling me, and that can lead to some bad outcomes. If we're friends outside the clinic and we go on vacations together and our kids do softball together, you're probably not going to mention to me that a month ago you had an episode of infidelity and about 3 weeks ago you had this one little painful, funky place on your genitals. But a month later, you've got this odd rash on your hands that you hope goes away on its own, and it does. And you never mentioned it to me. That's a big deal. What I've just described is syphilis, and when it got to the hand thing, secondary syphilis. So there's a lot to be said for it. You want to be comfortable with the person taking care of you. You want to have a certain rapport with them. But I don't know that it's a good idea for you to literally be friends with them, because you will edit yourself. You will be embarrassed. And as I said, neither one of those has any place in an exam room. And that's this week's show. That's why you shouldn't be embarrassed. It's why you shouldn't edit yourself, and why we're not friends. Hope you've enjoyed the show. Hope you've learned something. If either one is true, please click the like and subscribe button. Until next time, get better, make me look good. See you soon.